It's a life-threatening complication of an infection and the leading cause of death in the U.S. Yet only 35% of U.S. adults have heard of it, let alone know what it is. In this morning's Eye on Health report, we learn about the causes and sometimes deadly outcome of sepsis.
You can be the healthiest person on the planet. For example, you could be a very healthy marathon runner in your 20s and still develop sepsis.
Sepsis is a life-threatening and sometimes deadly condition in which the body improperly responds to infection. Its severe strike to the body can cause multi-organ dysfunction and failure.
Infections can be caused by a number of different things, probably the most common being, of course, viral illnesses, bacterial illnesses, but of course parasites, believe it or not, and fungi.
Dr. Brianna Schaefer with Our Lady of Lourdes Hospital in Lafayette says anyone can develop sepsis. However, small children, the elderly, and patients with pre-existing disorders have a higher chance of developing sepsis.
Diabetes, hypertension, underlying cardiovascular disease, and finally, patients who are immunocompromised.
Sepsis can also be detrimental to pregnant moms and their unborn baby.
That can affect a growing fetus depending on how far along or how far advanced the pregnancy is. There are different risks to the baby as well. And of course, the most serious of those, of course, being death for the mother and or the baby.
Dr. Schaefer says when looking out for sepsis, patients should refer to the mnemonic TIME.
T. Do they have a temperature that's much higher than usual or a temperature that's much lower than usual? I, what type of infection did they have? It can start as simple as something like a soft tissue infection or even pneumonia. And then M being changes in mental status or mentation. So if you see somebody who is normally very energetic and then all of a sudden they become very confused or they're saying things that don't make sense or they become very sleepy, that can also be an indication that they're in trouble.
There are ways to prevent sepsis by washing your hands with soap and water several times a day for up to 20 seconds. Avoid unnecessary contact with people who are sick or infected and staying up to date on your vaccines. If you suspect you are sick or have a general infection, reach out to your doctor as soon as possible.